of 2026. Congress 2027 lands us in the city of New Orleans, and this is being designed with a bold educational vision, one that deepens engagement, elevates active learning, and positions the CRNA community at the forefront of anesthesia innovation and clinical leadership. So it's been really exciting to work on this. So, Congress 2027 is not just adding more sessions, it's about elevating the quality, relevance, and the impact of every learning experience. So, let's look at the strategic priorities that will guide all of the programming decisions. So, we want to have, oh, go back one slide. There we go. We want to have attendee engagements. We want to be moving beyond that passive listening towards active participatory learning that changes how attendees engage. Second, we want evidence-based education. We want every session to be grounded in current evidence, be clinically relevant, and designed to drive real, measurable practice change. Third, we want balanced content. So we want thoughtful balance across clinical practice, original research, leadership development, and professional growth topics. And lastly, we want inclusive presenter pipeline. We want all experience levels, all the specialties, all practice settings, geographical regions also represented. So in this new Congress, we have some new presentation formats. So just briefly, we have podium presentations. So this includes clinical updates, research, master classes, TED style talks, year in review, and the case I'll never forget. Then we have clinical conversations. So interactive debates, expert panels, research roundtables, guideline updates, and audience-driven Q&A. And then lastly, the active learning labs. This is our simulation labs, our skill labs, crisis resource management, hands-on workshops, and procedural training. So you can see that Congress 2027 will introduce these three distinct presentation formats. Each are designed to serve different educational goals and learner needs. So you can really choose the format that best matches your content, your expertise, and the experience that you'll want to create for the attendees. And so Hallie's going to go into this a little bit more in detail.
Thanks, Andy. We know everybody learns differently. Everybody likes to teach differently. So we're trying to provide some variety on both sides of that. So podium presentations, we realize everyone has seen before, but we are looking to put a little bit different spin on it. We are looking for 30 and 60-minute sessions. The 30-minute sessions will be paired with a complementary topic to create a 60-minute session. We're looking for masterclass format, TED style talks, and right back to that recharge room that we're doing this year. We'd love to turn that into a CE for next year. So the case I'll never forget, kind of a case study presentation, but with your own personal spin of what happened, how you dealt with it to present to the audience. Year in review is a really important one for us. We are looking for annual updates covering the most impactful developments of the past year, and these are specialty focused. So, what came out new as far as pharmacology for pain medications in the years between Congress? What are some new OB practices or research in that year span? We want to stay up to date and current in all of our subspecialties, and so this format is designed exactly for that. And of course, clinical updates, emerging guidelines, again, what's changed in your specialty area. Clinical conversations are a new way to look at things. You've always been able to present in this format, but we've given it a title and its own category this time. And so these are interactive discussion-based sessions. So these are structured dialogue with a shorter presentation time and more audience feedback interaction time. So it's really about the learner, the attendee at the center of the learning experience. Case studies are also great for this. Expert panels, research roundtables. If you've done research, and want to present it in a way that you know is going to stimulate a lot of questions, this is a great place for that. If you want to present research with in a 30-minute format with someone that has done similar research, it's a great place to kind of see what's being done in a certain area. Debates, if you like to get up there and prove your point, this is for you. This could be one OB adjunct versus another, or one technique against another, and then opening it up again for audience feedback. And then guideline updates. If you want to talk about and get a lot of audience feedback on a new guideline, we will be doing this at Congress for some of our updated guidelines as well, so you can get a sneak peek of what this looks like. As far as expert panels, I just want to mention these are going to be a little bit different this year. There is a form to fill out if you'd like to be on one. And you fill out your subspecialty, provide some context of your expertise in this, and we'll help form those panels so they are geographically diverse, provider diverse, everything that makes a good panel strong and not just four people who work together giving the same opinion. And then active learning labs, we've always had these. We're looking for more of this. And these are this hands-on. We know a lot of people like to learn this way. We want to know about your faculty to learner ratio, any equipment and space requirements. And these are simulation-based or skills-based. Good topics for this are crisis resource management. We already have our Advanced Airway Academy going on in this format. So again, that's a great example of something we're looking for in this format. So Jeff, I will turn it back to you.
Thank you so much, Hallie. So a lot coming for 2027. So in preparation for Congress 2027, we want to talk a little bit about our abstract submission process, because that is the key to the door to getting you to present at Congress 2027. And we want to make sure that you share your clinical expertise, your research, the innovation with other national CRNAs, the other national CRNA community. And here in the next couple of slides, we're really going to walk you through everything that you need to know on how to submit a competitive abstract. So first and foremost, some really key deadlines that you really need to hone in on. As you can see here, the abstract submission process opens immediately after Congress 2026. So on August 27th, the system will open, and that is when we'll be able to have you start submitting your particular abstracts. But that abstract process is going to close on September 26, 2026. It's only open for about a month or so. Once that date has come and passed, we cannot accept any late submissions. So please do make sure that you note those dates and that you get your abstract submissions in early. In September, that is later in September, October, this is when the Professional Development Committee will conduct a blinded peer review process and deliberate over the selection of the particular abstracts that will be accepted for 2027. We plan to notify those authors by December 1st. And we give you a couple weeks to be able to either accept or hopefully not, but accept or decline a particular invitation to present your abstract at 2027. So let's talk a little bit about the review process and the eligibility. As it's been mentioned before, that every submission undergoes a rigorous blind peer-reviewed process. That means the reviewer, that means the author identities are masked, and we do that intentionally to ensure a fair and unbiased evaluation. And we actually extend that all the way to author notification, meaning that the Professional Development Committee, still during the notification process, is blinded to who those authors are, and they only know who has been accepted after the authors have agreed to present their work. And Additionally, looking at this slide and following our guidelines very carefully, making sure that you're familiar with them because there's many steps to it, will help safeguard you and keep you on track towards a healthy, comprehensive submission. Other things that you should be aware of. We only allow 2 submissions limits per individual presenter. And that's intentional. We're trying to encourage as many individuals and give plenty of opportunity to new speakers. So we do have a limit on the number of submissions per individual presenter. Please do make sure that you're using relevant peer-reviewed references. That is required. We've got a slide on that in a couple slides from now. We'll talk about that a little bit more, do a little bit of a deeper dive, but that's really important. And then also too, if you're using AI to help assist in the development of your abstract, you do need to disclose that. And so that is important when you are submitting your abstract. A couple things that you should be aware of that might disqualify your particular abstract. If you have missing or incomplete fields, particularly if those fields are required. We can't move abstracts forward if they are incomplete. If you have irrelevant, if you have fake or absent evidence, articles that don't exist that can't be validated, that will disqualify your abstract. If your learning outcomes are not measurable, if they're vague or they're poorly developed, that could disqualify you from consideration. And of course, if there is no identified practice gap or clinical relevance to your submission, that potentially could limit your abstract for consideration. There are 3 questions that I'm posing to you, that we're posing to you, that I want you to consider. And the abstracts typically do more than just describe a topic. They demonstrate why this topic matters. They're very specific on naming a practice gap, maybe it's a patient safety issue, a knowledge deficit, or even a workforce challenge. If there is no problem, there's no reason for your session. So you really want to address that question first. What problem are you trying to solve? Once you've identified that, the second thing you need to lean into is, why does this matter now? So maybe it's because there's new practice guidelines that affect our clinical practice, or maybe there's emerging evidence that's challenging conventional thinking, or maybe there's a recent regulatory change or some other type of evolving clinical reality that requires broader dissemination to a national CRNA community. So question 1, what problem are you trying to solve? Question 2, why does it matter now? And that leads us to number 3. What will attendees do differently after they attend your session? We want you to describe and be very specific, something that's observable in practice that will a change that you would expect. Remember, learning is not the goal. It's practice change. It's outcome change. And when we review a particular abstract, we're looking for impact, not just intention. So when you go to write that abstract, here's some things that some steps you should be following. So number 1, what is the current state of affairs? What is the current state of the evidence? What's the situation? Number 2, what is that problem? Is there a knowledge gap? Is there something that is becoming increasingly more urgent that we need to present and discuss with amongst our CRNA colleagues? Number 3, what is the scientific evidence? What does the literature say about the problem? What solutions, number 4, what solutions have been proposed and have been tested to really solve the particular problem that are worth disseminating in this particular venue? And importantly, going back to the practice impact, how is this going to change practice or influence a particular outcome. One of the most common mistakes that we see, and we put this in a yellow call out or a blue call out box here for you, is really when authors spend too much time describing what the topic is. And they're not spending enough time talking about how the session that they're proposing will improve a particular outcome. Remember, we as reviewers, we want impact, not just summaries of evidence. So here's some tips that we got from the Professional Development Committee. So my colleagues on the committee, we polled people and they provided us some feedback and some comments. And a lot of these echo what you're seeing in the slides before, as well as the slides to follow. And that is abstracts that are clear, that are concise, and aligned with the Congress's goals. Why should CRNAs care about this particular topic? Naming the gap and being very focused and very clear and concise in your abstract writing. Making sure that your scientific evidence that you're using to support your abstract is typically within 5 years, but the caveat being that seminal articles are absolutely acceptable. Making sure that you have some really strong outcomes and that you have used Bloom's taxonomy to write your particular learning outcomes. Showing engagement, talking about how are learners going to participate? Not just sit there and listen to your lecture for 30, 45, or 60 minutes. How are you going to engage them? And lastly, number 6, originality, right? What's the value, right? Recycled topics, they don't have as much value, although it may be important. We're looking for more innovative, more original, newer ideas to emerge. So let's talk about 2 different things here. Number 1, on the left side of your screen, right? The need, right? What is the need for your presentation? The need for the session? Ask yourself, are there new guidelines out there, a change in those particular guidelines that you discovered and you said, wow, this is really impacting my clinical practice, and I need to make sure that others know about this as well. Emerging evidence, something that may be focused, that's a real patient safety concern that's been recently identified in the literature, and that we need to make sure that our colleagues know about and know how to manage. Workforce, access to care, access to anesthesia challenges, or other types of new techniques. One of the things that I would say to you, and we give you an example here when we're talking about that needs. Ultrasound is becoming more common. That's a really true statement, but it's not a really powerful, impactful statement. Instead, if you could make this a little bit more robust, a little bit more catching, right? Here is an example that has a little bit more meat on the plate. The rapid expansion of POCUS into anesthesia practice has created a need for CRNAs to develop competency in airway, gastric, and hemodynamic assessment. And despite growing adoption, many clinicians report limited formal training and uncertainty in perioperative decision making. That's really a powerful statement. And that tells me exactly about the importance and the relevance of what you are attempting to present. Now let's flip to the other side. Let's talk a little bit more about that scientific evidence. We want published research. We want you using outcome data. If there are specialty guidelines, whether they are from another specialty profession like the American Heart Association, that's okay. That affects our practice, and we want to make sure we disseminate that to a broad audience. Consensus statements, quality improvement outcomes, and of course, implementation and utilization data. Don't just list the references. Don't summarize the evidence and explain why it matters. Another example here, recent recommendations support gastric ultrasound and aspiration risk assessment. And multiple studies show improved risk stratification when ultrasound findings guide perioperative decision making. Really strong need, really strong evidence supporting that. Okay, let's move now towards talking about Bloom's taxonomy, using the higher order Bloom's taxonomy. You only need one, and I want to emphasize this, one learning outcome per 30 minutes, and two for a 60-minute session. That's it. That's all you need. You're certainly welcome to provide more, but we don't need 5, 6, 7, or 8. That's too many, and they're difficult to write. We also want to make sure that you're making an actionable, measurable, deliverable task out of that audience member. So here we have in the blue box or the green box, we have words like analyze, evaluate, integrate, prioritize, implement. They're actionable items. They're measurable items. Those are much stronger, much more salient, much more measurable than when you use verbs such as understand, learn, know, appreciate. Very hard to understand the principles of lung ultrasound. How to really measure that? Instead, let's take that to the next level. Integrate lung ultrasound findings into perioperative assessment and management of respiratory complications. That is much more specific, much more measurable, a much stronger way of articulating what you are trying to achieve. So when we're looking as reviewers, we're looking more for changes in those clinical practice. Think about how your session is going to improve that patient outcome, or importantly, patient safety. And then other elements would be leadership, systems level of improvement, and of course, educational impact. Maybe less desired is attendees will learn about gastric ultrasound. Stronger, more focused, rewritten practice impact statement would be attendees will implement evidence-based gastric ultrasound protocols to improve aspiration risk evaluation, enhance patient safety, and support individualized anesthetic planning. That's a much stronger way of trying to articulate to the reviewers what you're intending to share with the audience. Let's talk a little bit more about learner engagement. We covered some of the different things that we were proposing for Congress 2027, a pivot more towards active learning. And that's what we want you to think about when you're constructing your abstracts. So we need to go beyond just the routine question and answers and the routine lecture that goes on for 45, 50 minutes. Instead, let's talk about audience engagement. Let's talk about audience polling, real-time feedback, maybe using simulation or skills practice, structured debate, or the think, pair, share model, which is more of that collaborative, active learning strategy where individuals within the audience are given a prompt by the presenter, and they have to work through that particular issue by discussing it with their colleagues and then sharing it with the wider audience. That is more active learning. It keeps individuals engaged on the topic, and it keeps them thinking in a forward direction. Of course, we want innovation. We want originality, right? And keeping in mind what our topic callouts are, really looking at obstetrics, pediatrics, rural cardiac pain, technology and innovation, safety, and of course, pharmacology. Make sure that you review those Congress priorities on patient safety and leadership, innovation, and the other elements that I was just discussing, which are here on the screen. We really do evaluate those abstract submissions for alignment with the Congress priorities. So you really want to be explicit about which priority your session serves and And finally, we can't get away without talking about a submission checklist. Yes, you want to make sure you have that submission checklist and you have covered everything because we don't want you to write this wonderful, great abstract and it's missing something that's critical that we need to know about in order to make an informed decision about your particular work. So before you hit submit, look at this checklist to make sure that your abstract is complete, it's competitive, and it is reviewer ready. Every box needs to be checked, and it needs to be checked with confidence. And if you're on the fence, pull back a little bit, go back, revise, strengthen. Remember, not about kitchen sinking things. It's about making something clear, concise, and cogent. So what are going to be my next our takeaway here for you? Know what the Congress 2027 priorities are. Spend some time talking about them. We're making them available to you now so that you are aware of that. And make sure that as you are constructing your abstracts, that you're doing it in a very focused way. Start writing your abstract now. This is September 17th. It's actually September 26th, 2026. That is the deadline. You cannot submit after that date. So we don't want to miss your incredible work. So make sure you're doing that planning now. In fact, what I would do if I were you is I would start mapping this out now. And once I got my abstract to where I think it was submittable and I looked at that checklist and I was comfortable with that, I would put it down and I'd walk away. I'd give myself a little bit of time, a little bit of space, and come back to it with a fresh set of eyes and a brain and see if there's any revisions I can undertake to make it stronger, to make it more clear and more concise. Then I would submit. Make sure you get your colleagues to submit one as well. Encourage others. You know, you work with some amazing individuals. We want to hear from them. I want to hear from them. You guys do wonderful things every single day. You have very sophisticated, very complicated conversations at work. Let's hear those and let's have those conversations amongst the audience. Finally, don't forget to register for Congress 2026. I can't wait to see you there. We got a great curriculum, and I can't wait to hear and see you there, and also talk to you about what you're going to be submitting for Congress 2027.
Thanks so much, Jeff. I'm going to stop the presentation now. And you brought up some great points. I think it's a great time to kind of turn it over to the Professional Development Committee and get their tips and feedback and have them answer our audience members' questions as well. So if you have questions either about this year, 2026 Congress, or the 2027 abstract process, please put them in the chat and we will do our best to get to all of them.
And Hallie, maybe why they're with some of those questions are coming through. Maybe I can ask the PDC members a little bit about what some of the things that they've seen in abstract submissions, some things that they would like to see. So, Hilda, let me bounce the first question to you. What's something that stands out to you in a really strong abstract?
Yeah, thanks, Jeff. One of the things I think we're looking for is making sure that we can understand the flow of your presentation. How well are you able to describe the active learning workflow with the audience interaction? So if we're kind of having trouble putting the dots together, it makes it a little difficult for us to move forward with that particular abstract. And one other thing is a lot of times we get abstracts that have been presented at other meetings.
Mm.
Maybe last year at AANA or maybe at some other in meetings within the US that different companies are sponsoring, whatever. And it's lovely that you put that on there that they've been presented elsewhere. But how have you freshened up those presentations? If it was presented last year, have you looked at any new literature that's come forward? Make sure that that is evident, because otherwise it just like looks like recycled material that maybe everyone's heard before or doesn't really bring up-to-date information. Make sure your references are up to date. And those are the two things that kind of stick out continually year after year.
That's Hilda, that's some solid advice. I actually agree with all of those. I definitely would concur. I think another recommendation I maybe think about this is before you submit, you don't work in a silo. Maybe have a colleague kind of review your abstract and who maybe unfamiliar with the topic. What is it that they get? Are they understanding what you're trying to achieve? Is it very clear to them? Lindsay, what are your thoughts on this?
My biggest takeaway from reviewing abstracts last year was just organization. I think we had 140 to go through last year. So if it's organized, it's a lot easier for us to see what you're presenting, why it's necessary, and it's just very helpful to the committee as we're reading through. You may be the 128th. If it's organized, it's a lot easier for us to get through. And then just to reiterate what Jeff said earlier, one or two learning outcomes per 30-minute presentation. It gets tough for you as the presenter to have to have all those learning outcomes if you have more than one. So that would be my biggest takeaway just from reviewing abstracts for 2026 Annual Congress is organization. And once again, like Jeff said, have a colleague look at it and say, does this look okay? Like, is this too much? Is this all over the place, or is it pretty streamlined?
Andy, any thoughts?
Well, I agree with the other committee members. One thing, we like to have recent resources, right? At least within 5 years. We don't want to be, don't quote other resources that are 10 years old because we want new, innovative, up-to-date things part of your presentation.
Yeah,
Yeah,
and Jeff on the and Andy on the resources. I know that sometimes historical presentations come through, and we do take that into account that they are historical, and they offer a lot of good information. So those resources would be definitely older, potentially older than 5 years. So we do take that into account. That wouldn't discount any of the historical information that would be beneficial to be shared.
Yeah, that's a good point, Hilda. So thank you, and Andy, you're 100% correct. Yeah, I think all of that really important components into a strong abstract submission. So Hallie, did we have any questions or any thoughts we can help kind of clarify for the audience?
Yeah, there's one that I think will be great both for our faculty here and our PDC. So, what would make, in your mind, a strong submission for a learning lab? And I'm going to turn to the faculty too because they have submitted many in this category and been really successful. So maybe they can give the tips from their side, but you can first talk about from the PDC side what you're looking for in those active learning submissions.
Yeah, I mean, I'll just mention very quickly again, how are you engaging the audience? I think that really is so important. Is it something that's doable and tenable? And what are you trying to achieve? That's so important. Again, we don't need it. If we're active learning, we don't want just a regurgitation of the literature in a lecture. We want to see involvement in some kind of deliverable back. You're giving a deliverable to the audience. Is the audience giving you a deliverable back? And what is that going to be? And how is that measured? I don't know if my colleagues have something else to add to that before I turn it over to faculty.
I think that's a great point, Jeff, kind of that teach back, what what can they demonstrate at the end? What did, again, not focusing on the learning, but the practice change and the skills learned and the changes that can ultimately really result in better patient care and patient safety. Before I turn it over to the faculty, any other thoughts from PDC members on that? So Mark, Jeremy's on. I'll look to your guidance for this as three members that have written many successful types of these applications. What are things you make sure you include in these?
I'll start up here. Uh, um, First off, thank you for the opportunity to be here tonight. We're very excited to put on the PEEG workshop, pre-Congress workshop. So for those listening, if you have not signed up, this is going to be something. Along those lines, I kind of want to go back a little bit to what Jeff was saying about giving yourself some time to write to write the abstract, because it really matters when you can get your thoughts into a little paragraph essentially, and to make it really impactful. So giving yourself the opportunity to write that, step away, think about it some more, and come back at it. Every time I've done that, I change it a little more, and it becomes better. And really what people want to hear, in my experience, is they want it to be practical. They want some kind of value that you are bringing to the table. What can you bring that will provide value in their practice? And have that be the ultimate goal, and you're going to win. You're going to get there.
Excellent. Mark, did you want to add anything, or Zahn?
Yeah, so just to piggyback a little bit off what Jeremy said, in terms of like topics to pick something that you're truly passionate about. Look at your own clinical practice and say, hey, this is something that I really want to delve into, that I'm willing to, dedicate the next year to actually developing, right? Talk to your colleagues, make sure it's something that other people are also interested in. And 9 times out of 10, it's going to be something that other CRNAs across the nation are also interested in too. So along the lines of process EEG, we've been using the clinical practice, but in terms of using that index, we all know that there's, some things that are not ideal about that. But looking at something like the DSA, looking at the raw EEG, individualizing that care for the patient and putting them in an adequate depth of anesthesia, not too deep, not too shallow, but that sort of Goldilocks effect for them. And that's where the EEG really comes, for me, and tailoring my anesthetic for each individual patient, as opposed to just putting them at like, 1.3, 1.5 Mac and just, chilling, cruising along. It's like, am I really providing the best care to my patients? Am I really advancing the profession by doing that? No, not necessarily. I'll get through the case, but is it best for the patient? And we need to advance our practice using technologies that we have, i.e., process EEG, point of care ultrasound, cardiac ultrasound, advanced airway techniques. These are things that really move the profession forward, and which all the faculty here are truly, truly passionate about. So pick something you're passionate about, colleagues are passionate about, and you'll go a long way.
Great advice. And just before we go to you, Zahn, I just want to mention, like, I don't use biz monitoring or any type of that in my practice. And so this was a topic that was introduced to me through this workshop that we're having, and I cannot learn enough about it now. I have been reading everything. It is fascinating. There is so much beyond the index, which I think is the title of our workshop. But if this is something you've ever wondered about or thought, what's really the value, this will answer all those questions for you. It's hands-on, it's interactive, but you also get some of that traditional learning because we know that this is new information for a lot of people. And so, Zahn, I'll turn it over to you. What you think makes a strong application for an active learning experience?
Well, a strong application is just like Mark said, it's something you're interested in. And so when you go to meetings, you go to Congress or your state meetings, and you go to things that are interesting to you, don't hesitate to stop and talk to the speaker. If it's something in your practice you want to learn more about, or you can collaborate. And I tell you what, I haven't had more fun working on a project than I have this year with this group. They're dynamic people from the other side of the country, it actually makes this fun, and it makes submitting and doing a project easy, especially when you bring a lot of high-powered people to the table.
And I kind of want to touch on that. Mark and I actually had a conversation about this earlier today. That's one of from the AANA, forget the abstract grading and forget the presenter or abstract applicant tips. But from AANA, we really want to make sure we have presenters that are passionate about their topic, but also really in these active learning experiences more than anything else, creating that conducive learning environment for the learners so they feel safe to learn and admit what they don't know and grow and leave there with a sense of increased confidence, knowing something and feeling good about what they learned. So that environment, which you will see on the application, is also really important to us. All right, and I think we just have time for one more question, and I'll start again with PDC. Um, Tell us about the interactions that you like to see. What do you guys find in the applications that makes them appear like they will be more engaging? Are there certain words? I know we touched on think, pair, share and some of those techniques, but are there things that make you think, yes, this is something everybody needs to do, something everybody needs to know about when you look at those applications?
I'll just start off by saying what and speaking for myself, when I'm reviewing an abstract, I try to read what's in the scientific literature and the journals on a monthly basis. And I love abstracts that challenge conventional thinking, that ultimately change practice, that makes me stop and go, wow, I'm going to read this again, something that I haven't heard of. And I certainly have read a few abstracts in the past that I actually topics I didn't know anything about. I didn't know the depth of it, or I thought I knew, and it made me rethink something. So it made me go back to the books to learn more about a particular topic. That is stimulating to me, and I absolutely love that. I'll yield the rest of my time to my colleagues.
Yeah, I was just going to say it's very important that it's something that's important to practice with the audience that's there. So, it might be some brand new rRNAs that are now becoming cRNAs, but whatever's important to their practice. And so something that, um, that sparks my interest on, oh, well, I didn't really think about it like that, or no, I haven't heard about that technique like Jeff was speaking about. Those kind of things that I think will be most engaging to the population that's at the Congress. So that's one thing I think.
I also think about, as we said before, what's the value and how is my practice going to change after learning about this topic? Because you want to change and you want to walk away with new knowledge and new ideas. And also just any topic that is like, oh, that's a really good review, or anything that's kind of changed from, I mean, there's a lot of CRNAs that have been there been coming to these meetings for a long time, and we've gone to school a long time ago. So any new updates and any new cases and stuff, it's always good. It's always fun to learn about.
And I think you and Hilda both bring up kind of this point of there's different levels, different experiences of providers. And that is one thing we're trying to aim for in 2027 also, is to have that novice provider, mid-career, expert level content, and have that divided out for people too, so that they know, what sessions are geared for their experience level. I want to thank all of our panel members for being here. And if anyone has any final thoughts, whether it's about the workshop or the abstract process, please feel free to share them. All right. If not, we will call it a night. We appreciate everybody coming, and thank you again to all the presenters for taking time out of your schedules to be here. So we will see you at Congress. Come find us. Thanks.